Hi there, I'm Dr. Gary Simmons of Carilion Clinic Neurosurgery, and I want to talk to you today about hemorrhages in the brain and around the brain. Hemorrhages and hematomas. It's a large subject, but I want to give you some background in it. There are different ways and different types of hemorrhages that can occur around and in the brain, and it's important to understand that they are different entities and they can cause different problems and need different types of treatments. So I'm going to go over them briefly for right now, and then we'll look at individual types in separate sessions. A lot of hemorrhages that are related to the brain are caused by trauma. The patient is involved in a motor vehicle accident, a fall down the stairs, an assault, that sort of thing. And there can be bleeding, hemorrhaging around the brain or in the brain, and it can occur in different areas. The brain is contained in a bag of fluid called the dura, and hemorrhaging can occur on the outside of the dura or on the inside of the dura, and it can occur within the brain itself. If it occurs on the outside of the dura, it's called an epidural hematoma. Hematoma just means blood clot. And often with a head injury, there can be bleeding on the outside of the dura called this epidural hematoma. It's usually caused by a fracture in the side of the skull and a small blood vessel that lies just underneath the skull that bleeds and accumulates blood in a hematoma. If this gets large enough, it crushes the brain and the brain can start to shut down. If it shuts down enough, a patient can go in a coma and they can die. And so it can be a horrible situation. So if a patient after a head injury sustains an epidural hematoma and they go in a coma, this is going to need emergency surgery, real emergency surgery, meaning right away. Another type of hematoma that can occur with trauma is called a subdural hematoma. This bleeding occurs just under the sac of fluid that the brain sits in. It usually occurs because the brain surface itself has been really roughed up from the accident. It's been beat up and bruised, and it oozes blood and surrounds the brain and can form a hematoma or clot. And if that gets large enough, it too can crush the brain, cause coma, and cause death. Again, if it's getting that bad, it wouldn't necessarily need to be removed through surgery. Epidural hematomas, if caught early enough, tend to do better than subdural hematomas because epidural hematomas were caused by a fracture in the skull, and the brain itself may have been okay before the clot created too much pressure. Subdural hematomas tend to do less well because they're caused by a real roughing up of the brain. And the roughing up of the brain is still there even if you remove the hematoma or the blood clot. Now, when you go to remove these hematomas, when you go to remove these blood clots, they can't be removed by a simple hole and let them drain out because they're a clot. They are clotted blood, and therefore a large opening in the skull needs to be performed. A large opening, as big as my hand, may need to be done to remove the clot. Often we'll put the skull back and fasten it with small plates and screws. But sometimes we'll leave the bone out if the brain is too traumatized and swollen. There are other types of hemorrhages and hematomas that we need to discuss, but we'll do that in a separate session. Thank you. Bye-bye.